done, finally. Hi, welcome to another day, another vlog. It's been a while since I've seen you. We're currently packing because we're getting our boobies done, finally. I'm turning 30 this year and I said no more waiting. We are doing this. We're doing this now. It is Sunday, March 10th and surgery is scheduled for tomorrow, the 11th, and my check-in is at 5:45 a.m. My surgery I think is at like 7:15 a.m. I am not feeling really that nervous right now, but I feel like in the morning I'm gonna be kind of nervous. I've been filming all day. I'm kind of nervous actually. So basically I'm just packing a bunch of stuff. Packing a bunch of PJs, a bunch of sweatpants sets. Hold on, I feel like you can't really see me. PJs that have like buttons down the middle, sweat sets with just zipper hoodies. I'm staying with my parents for a week while I heal. I'm taking Bean over to my friend Rose's house. He's gonna stay over there. Actually, the recovery is like 6 weeks, but after a week, they said I should be okay to like back to normal activity. I really don't know what to expect. I'm kind of nervous, more nervous for the recovery than the surgery, just because I know like obviously being put under is a little bit scary. But this is something I've always wanted since I was like maybe 17, 18. I was always like, I'm gonna get my boobs done. I'm more nervous about the recovery. I'm really sad about leaving Bean for almost a month. He knows something's going on because he knows I'm grabbing my bag. I gave him a bath today. I packed his stuff. He already knows. But I just feel like he's gonna think that I'm like leaving him for so long. I've never left him that long. It's getting really late and we need to go. I literally can't have anything to eat or drink after midnight. It's almost 8 o'clock. This is what the car looks like right now. We're literally packed. We're so packed now. Being you ready to go? I feel so. Morning. It's 4:45. We gotta leave in like 30 minutes. This is my last day. I'm scared. I don't know what the heck I'm doing to myself, but I'm excited, mostly nervous and scared. This is the weird antiseptic skin cleaner that I have to use in the shower. It literally smells like the hospital. This is what I've been showering last night with and this morning. Here's our little outfit. We got a little Yeti set. Slippers. So we're just gonna do regular braids. I had to literally like take off my nails. No jewelry. I have some permanent jewelry on right now. I feel like they're gonna have to cut it off me. And you can't wear your contacts. You have to bring your your case for your glasses because they put all your personal items, so I can't bring that. Okay, let's go. My boobs are not blue like this anymore.
Say goodbye. Farewell.
What? Hello. I can barely move. I feel really stiff right now because I just got up. Now it's like 9 o'clock and it's time for to take my medicine again. Oh my gosh, and on this side. He ended up putting 2 different sizes in. Right side was smaller than my left side. So my left side has 520 cc's and my right side has 560 cc's. He also did a lift. That's the update. Other than that, day 1 was okay. It hurts really bad.
Yeah, you're gonna, of course it's gonna hurt. You're tough.
It feels like it's trying to pop out.
Okay, which one do you want?
I think the black. I'm scared. Are the cotton things gonna fall off?
Mm-mm.
They taped them to me?
He said, yeah, and they're naturally gonna fall off. Do not pick at them.
I'm scared. I don't know.
Okay.
That was really hard. Day 1 was okay. I was just very nauseous from all of the anesthesia and stuff. Day 2, the pain is a little bit worse. But I also it was time to take my pain medicine again, so maybe that's why I'm feeling the pain. Okay, we'll check in more later. Okay, also, another reason why I'm in a lot of pain is because he did liposuction as well on the sides. It's the end of day 2. Day 2 was a lot harder, just very sore, and it's hard to take deep breaths. And I'm supposed to take, I think, like 15 deep breaths or something like that every hour. My skin is very tight. I just had the surgery yesterday. This is day 2. I think we're doing pretty good. Maybe tomorrow we take a shower, but not yet. Good morning. It's day 3 post-op. It's like 9:30, 9:15 in the morning. It's time to take my pain medicine again. So sore. It hurts. I also have muscle relaxers. I just got out of bed and nobody's home. It's like all the way out into my armpit. Is that normal? They're rock hard. This is how I've been sleeping. I have all my water, snacks, medicine there. I sleep sitting up on this thing. For a few days I had a neck traveling pillow. This pillow over here, that's to lay my arm out. And then I have one under here that's for my feet, to elevate my feet. And then we had the diffuser going because day 1 I was so nauseous from all the medicine that we have peppermint oil diffusing in the room. And then my mom sleeps right here next to me. Still doing okay. My medicine makes me kind of like dizzy and kind of like I'm gonna fall over. Oh, the other thing I'm taking is arnica pills. This helps with bruising and swelling. You can't even see them, but they just are like these little white pellets that melt under your tongue. And where's our date? Good decided to show up. She brought me grilled cheese. Yummy. No coffee though because we gotta keep my heart rate down. Did you try the lavender or no?
No.
Hi. We're day 4 post-op. I don't know if I was able to film yesterday when we actually changed my bra. I legit almost passed out. Yesterday we changed my bra because the hospital ones were too loose and you want one that's like compressing. So I have this one. It's like compressing the boobs and then it also has the strap that goes across. That's it for now. So we just had our first shower. It's day 4 post-op. My mom helped me. I can like get in and out of the shower by myself. I am on pain medicine obviously, so like I wanted her there with me, letting water run. Really, they said don't let the soap, like don't actually scrub it. They said just let whatever soap from like your neck or whatever just like fall down. She had to, obviously I can't like reach my back, so she scrubbed my back. You definitely need someone there to help you just in case so you don't fall. Definitely someone to help you shower, somebody to help you stay on top of your medication. I took off the bra and there's a lot of bruising on the sides where he did the liposuction, but all the incisions and everything are looking good. He did move, so those are kind of looking a little strange, but I think it's normal for how they're looking. And for whenever we were like drying the incisions, we pat dried, and then we still also did a blow dryer on the very low setting and the cool setting. I don't know if you should or shouldn't do that. Ask your doctor, but that's what I did. We are going into 1 week post-op appointment. Walked into the office. Lone Star plastic surgery. This is Dr. Hill. This is what is inside of me now. We did a 560 silicone, right? So it's the gummy bear. It's like more solid than the saline that's just like water floating around. These actually feel like more natural. So this one is on this side, and then the 520 is on this side. They just feel like they are part of it. Hello, we haven't talked in a while. We're sitting outside of my doctor's appointment. We are doing the 3-month follow-up. I just went to go do the after pictures and they're gonna upload them and I'm gonna get to see them. I probably can't show you, but I'm so excited to see the before and afters. That's how we're looking. Here we go. Okay, so it's been a couple weeks since that last 3-month post-op appointment. We're still in the 3-month frame. It's been a busy summer, okay? Let's talk about all things getting my yitties done. First question, obviously, who did I go to? I went to go see Dr. Hill in Frisco. He is kind of like by the Star area. The first doctor, the reason I really didn't go with him was because, and he was also here in Dallas. I don't I mean, there's nothing bad to say, it was just personal preference. But the first doctor that I went to a consultation, I think my consultations were about a year apart because I constantly kept researching, constantly kept looking. I even almost considered going to Mexico and getting them done, but I'm so glad I didn't. I love my doctor, he's the best. The first doctor I didn't go with because originally I was only gonna do a lift, I wasn't gonna do an implant, but I was like asking like what's the benefits of having an implant, kind of like just I didn't know anything. So I was like, well, do you recommend? This is kind of the look that I want. And I didn't feel like all my questions were being answered. He was kind of just like, yeah, I can do whatever you want, just let me know and I can do whatever you want. But I was like, well, I'm on the fence, I don't know what I want. Always I did know I wanted a lift, but I was like unsure about the implant. So one, I just didn't feel like my questions were being answered. He was, and I know he's a good doctor, but he was like, yeah, I can do whatever. So I was like, okay, let me just keep looking and maybe get a second opinion. Originally I was just gonna go with him because I have friends that went to him as well, but then I was just like, I don't feel 100% comfortable, and the number one thing is you should feel comfortable. You are having a major surgery done, and I'm like the type of person that is scared to go under. I'm scared of everything, blood, needles, being put to sleep, like it all just freaks me out. I actually don't even exactly know what happened during my surgery because I didn't want to see any videos or know what was, I didn't want to know what was going to be happening. Anyways, back to the first doctor, and this is a question that was asked, is what kind of scar do you have? So the first doctor was going to give me an anchor, which was going to be like around, down, and across. So it was going to go like around, down, and across, like an anchor. And I was like, that's a lot of scarring. I don't know how I scar. I've only ever had one other emergency surgery and I had to get my gallbladder removed, and I feel like those scars are okay. So that's my gallbladder scar, but I didn't do any like sort of scar treatment or anything on it. Thankfully, scarring is going great. I would say you can't even really tell, or for how much was done, it looks really good. I have a lollipop because the doctor that I did go with, Dr. Hill in Frisco, did a lollipop. So he just went around and straight down. So it's like minimal scarring. The other things, make sure that you, whenever I was looking for a doctor, I made sure that I found a doctor that was board certified. That is super important. Apparently you can go get a certification or something to do a surgery, but you want a board certified surgeon. Another thing that I was very aware of and that I was looking for in a doctor was I wanted a doctor that performed the surgery in a hospital, not in their office or their clinic. That's a red flag. If the doctor is performing the surgery in their own clinic or their own office and it's not like attached to a hospital or anything like that, red flag, don't do it. What if an emergency happens? What if you need, like, I don't know anything about medical stuff, but what if you need a blood transplant, or what if you start having a seizure or cardiac arrest or whatever can happen? You never know what can happen during the surgeries. At least you're in a hospital and there's plenty of specialists and doctors and nurses and departments like ICU and I don't know that can like help you, versus like if you did the surgery in like a clinic or an office. What would happen if an emergency happens? They have to call like an ambulance, come get you and transfer you to the hospital? No thanks. The staff was amazing at Dr. Hill's office, very helpful, answered all of my questions, very nice. Still, like, anytime I had any issues during the healing process, like, I was able to ask. They've been like holding my hand the whole way and still are. Okay, so the other thing is I went with whatever he recommended. I did send him like inspo photos, so make sure you have his inspo photos, and he kind of like educated me on the different implants and all of that. All of my people around me that have had their breast augmentations, have saline. Sorry, they have saline, which is, it is a silicone like capsule, but it's filled with saline water or something like that, where if it like pops or leaks into you, nothing's gonna happen. I decided not to go with the saline. I did silicone. So I have silicone in here. They're also known as like the gummy bear. They are the ones that look and feel most natural, in my opinion. Also, that's what the doctor said. As somebody that does this every day as their career and as their profession, I'm gonna take their advice, because I personally wanted something that looked very natural. I literally told him, just want my boobs but better. So he put 360 cc's in my right side, and I want to say 320 cc's in my left side. Before, I had no volume up at the top, so that's why I decided to go with the implant, because I wanted not just the lift, I also wanted them to look full, like up at the top, but I didn't want any, like I didn't want them to look like balloons shoved inside. So we did go under the muscle. The reason why we did the one bigger than the other is because originally my left side was smaller than my right side. So he kind of picked implants based on what would look even. So he made this one bigger and this one like a normal, I think 320. So now they're pretty even, or as even as they could be. You have to also choose the profile that you want, like how far you want them to stick out. If there's like moderate, high, and ultra high, I went with the high. So like in between moderate and in between ultra high, because obviously I'm spending money on this. I want you to be able to tell a little bit that I had something done, or I just wanted to look more enhanced a little bit. So that's why I decided to go with the high profile silicone. Now, I know I said that the saline can pop and then like nothing will happen. These can also rip or pop or whatever. So there, you have to know the pros and cons, the risks with either one. You just have to decide on your own. Dr. Hill really kind of educated me on both pros and cons. I also did a lot of research on my own, so I was able to make that decision. Yes, it can like rip, but the gummy or the silicone inside is like solid, so like if it rips open, it just stays together. I've been sleeping on my stomach, I've been sleeping on my side. They don't really bother me. Honestly, I thought I was gonna have like back pain. I don't have any back pain. So before my surgery, I was a 36 double D. And like when I would wear the bra, obviously it looked like this. Actually, these look better, but because I am bigger now that I look at the befores and afters, which if I have any befores and afters, I'll put them here. After now that the swelling has gone down and everything, I went to Victoria's Secret and I got sized, and I tried on a couple different bras just to make sure. I'm a 36 triple D now. Also, the pain level of the surgery, I don't know. I didn't feel anything, and me like being put under was like the #1 thing that I was like so scared of. But honestly, it was all fine. Like the hospital staff even like made me feel super comfortable. I walked in, they just make you like pee in a cup, and I think they just do like a pregnancy test just to make sure, and then they change you out of your robe, and then I was just like sitting in the little room with like a heating pad on, and because they want to keep your body warm before you go into the cold like operating room. So I was just sitting there with my little heating pad on, and the doctor comes in, and I had like, I think I want to say like 2 or 3 pre-op appointments. Like I had my initial consultation, then I had like my pre-op where we decided the sizing, the look, they ordered the implants, I think they took pictures at that time, and then I saw him again like a 3rd time before the surgery. So I felt really comfortable by the time he came in. I was not like nervous at all. That was before they put anything in my IV or anything. Like I was totally fine, and I am an overthinker. I stress, and all of that freaks me out. So if I can do it, you can do it. I'm not telling you to do it, but if this is something that you've been wanting to do, I don't know, I just felt really comfortable. So he came in, he like marked me up, then they put the stuff in my IV and I kind of started feeling a little loopy. They rolled me in, they put the thing on my face, immediately knocked out, and what they did, I don't know what they did. I know they did a lot of work because they look really good. They're like nice and lifted. The implant is in there, they've dropped now. Everything is looking so good. I'm so happy with the results. I woke up and I just remember being really, really nauseous to the point where I like didn't want to open my eyes and I didn't want to get up. But I was like in the bed and I was like, what size did he put on me? Because I didn't know at that point. We knew what sizes we ordered, but we didn't know if we were doing two of the same, one with the other, whatever. But I just remember being really, really nauseous. That was the main thing. I don't remember feeling any pain. I remember trying to eat a cracker and I just couldn't. And I was just like, do I have to wait here, like in the post-op recovery room or whenever they're like trying to wake you up? I was like, do I have to wait here till I like feel better? And they were like, oh no honey, you're gonna be feeling nauseous like for the rest of the day. And I was like, well then, like, can I please go home? So then I got up on my own, walked to the bathroom, peed, and then my mom kind of like helped me get dressed just because I was like so uneasy and couldn't like stand up. They literally had like a fall risk bracelet on me. Yeah, I don't remember feeling any pain. I just remember the nausea. Then I went home, got into bed, and that first day he does something called like quick recovery or something, where like if you're literally just doing like a normal breast augmentation without the lift or anything like that, I think you're good within like 2 days. He said mine is considered a quick recovery surgery. That could be something that you ask your doctor, ask if they do a quick recovery surgery. He said mine would have been quicker if I didn't have like basically 2 procedures done at once, the lift, the implant. Oh, and I forgot to say, he did do lipo on my sides. He did lipo. I was just really bruised up, like I don't know, I don't remember feeling pain though. I did stay at my mom and dad's house and she helped me take all my pain medicine, stay on top of all my medicine. I think I was on anti-nausea, pain medicine, and I think that was it. Oh, and I was taking arnica to help with the like bruising and stuff, bruising and swelling. I'll also leave a links down below for my Amazon storefront where you can shop literally everything that I bought, bras that I bought, the arnica pills that I bought, like the soap that I had to use before I showered. There's so much. I would say the pain was like a 2 maybe. I couldn't use my chest muscles to like get in the bed like this, so I just had to be very cautious of that. I think I couldn't use my chest muscles for 6 weeks. I couldn't lift anything above 10 pounds, and obviously I couldn't like lift, I couldn't like push, I couldn't do anything with chest. Like mentally and physically I could, but I wasn't allowed to. I think that was the main questions, and then also like how much I paid. I don't want to go into the details of how much I paid because it all depends on what doctor you go to, what procedures you're getting done. I know I can tell you what they charged me. They charged me for like the anesthesia, they charged me for like the hospital, I think they charged me for the breast lift and the breast augmentation. They charge you for the implants. Oh, and they charged me for the lipo. That's not something that I asked for. That's something that the doctor recommended with the look that he was doing for me. He just said I had like some just like fat pockets, like the side boob bra fat area, and he was like, I'm gonna go in and take that out as well. In that, it included like my pre-op, my post-op appointments. I think it included like 1 post-op bra, but I do recommend getting like 2 extras because the bra that the hospital gave me was like way too big, but then the bra that I ordered was too small because of how much swelling I had. Now I wear the originals. I'll leave sizing and everything below of what I ordered, but really they all stretch and they all fit pretty comfortably. But I was just so swollen and my implants were like up to here that it didn't fit, so I had to order another one. Don't be scared when you wake up and you have square boobs and they're up to your collarbones. That's normal. Your boobs are gonna drop. You just gotta give them time. I'm at like 3 months and this one, my right side, is still dropping. Like this one is higher than this one right now, and it's just been because this is the bigger implant, so it's just taking a little bit more time to settle. I still wear my post-op, my post-op bras, my post-surgical whatever bras. I still wear them. I still sleep with them. They're like my security blanket at this point. Right now I'm in scar treatment, which I don't have to go and like do anything at the office. It's literally just like a gel kind of cream that I like rub. The stitches just fell off naturally. I think I showered like day 2 post-op, and my mom had to help me shower after that. And it was just kind of like, because I didn't know, like I didn't want to slip and fall in the shower, whatever. She helped me my first shower, which I think was like day 2 post-op. Yeah, I showered with the like tape that they put on. Your doctor will give you all your instructions. Don't follow my instructions. Your doctor will give you your own post-op, pre-op and post-op appointment, like pre-op and post-op instructions. But for me, I had like, I guess, dissolvable or stitches that just fell off on their own. I honestly didn't notice it because I constantly was putting, at first I had like a tape, and then I went into the office a week after and then they removed the tape, and then I still had stitches, but I was putting like, honestly I can't remember if I was rubbing anything on them like antibacterial or anything. I don't think I was on anything. I would think I was just putting like Aquaphor on top of the stitches, and that was one thing that I couldn't even look down to see because I was freaking out at what they did. They literally removed my pepperoni, took it off, lifted everything and did everything, and put it back on. So yeah, there was stitches all around the pepperonis and down. So yeah, I remember looking at it like the first day when they were switching out my bra, my mom and my aunt, and I remember I got lightheaded and I had to like hold on to something because I was like, oh my gosh, like what the heck. Another thing that I was asked is like, do you lose sensation? I did not lose any sensation. They still are healing. Like I said, I'm doing a scar treatment, which is just like a gel that I rub on them, but I did not lose sensation. I think that is one of the cons with the surgery. Maybe some women do and some women don't, but thankfully I did not. I did go back to working out at 6 weeks, and my workouts are like kind of like HIIT, hot yoga, things like that, and it was too soon. Like technically I was cleared to go back at 6 weeks, but it was way too soon. I ended up opening up, like I had no stitches, but I think just the skin around the pepperoni was like a little too thin or something, that I did a jumping jack or I did a burpee or something and it opened. They said that is normal. It was nothing to worry about. I just had to make sure that it didn't get infected and like start oozing yellow or green like pus and smelling weird. So I basically had to stop working out again, and then I had to clean it with peroxide and put Neosporin on it. So that's kind of like one of the things where it's been a little hard just getting back to my normal routine. Even now I'm at 3 months and I'm going to my classes again. I'm still not doing jumping jacks and I'm still not doing burpees. I'm not doing any of that because I feel like some areas where the stitches were, maybe the skin is just still too thin, so any like jumping or anything like that can open it. But I think that's pretty much it, all the questions. I don't want the video to be too long, so if I missed anything or if you have any other questions, just leave them in the little comment section below. I will either reply back or maybe I need to do like a whole nother like part 2. Anyways, I'm so happy with my decision. I'm so happy that I finally went through with it. I'm about to enter a whole new decade, So it was about time that I got them done, and I'm so happy. One of you said, what's the hardest part of surgery prep and recovery, and does insurance cover any of it? I don't know if insurance covers any of it because I don't even have health insurance. So I think maybe if you have health insurance, and because it's a breast reduction, maybe they could cover some of it. I would ask your doctor. Hardest part of surgery prep and recovery. I would say this hardest part of surgery prep was just, no, honestly, I don't think there was any hard part of the prep, because I had a list of like snacks I wanted to pick up. I didn't even watch movies or shows because my medicine would just put me to sleep. I would just say the most important thing was I kept myself really busy the day before, and I did an early morning surgery. I had like my surgery at like 5 or 6 a.m. or something like that, just to make sure you have somebody to take care of you. Also, sometimes I wasn't even like too hungry. I would just have like a Smoothie King smoothie. The Hulk was like what I was wanting all the time. I don't know why. And then the recovery, hardest part of recovery, I would just say, like I was mentioning, like making sure to like, because you're gonna feel fine. Like if you're taking your pain medicine like normal and your doctor did a good job. I mean, I'm telling you, I feel like mine was like, I had friends that just had a breast augmentation and they recovered a lot quicker than I did, because I had the lift, the breast implant put in, and then I also had the liposuction. But all that saying was, it was so easy. Like pain was a 2. It's just mentally like, you feel like you can do everything, but you really can't. Like you can't lift anything up, you can't lift yourself up. Just really remembering to not do that, because you could mess up something internally, have to go back into surgery. You don't want to do that because it's a lot of downtime. So really just planning for it. I did mine in the spring and I'm barely ready for the summer, so I would have probably done it in like the winter if I would have planned better. But really, I don't think any of it was that hard. Just planning, making sure you have everything ready, all your sleeping situations, accommodations, whatever, all of that is good. And just like make sure not to go too hard when you're recovering, because even like when I was at my apartment alone, I think I stayed a whole week at my parents'. Then I came back and my dog wasn't staying with me for like I think 2 weeks, because I was like making sure I didn't have to pick him up in case we went outside and something happened, or making sure he wasn't like walking all over me. But other than that, I don't think anything, it wasn't really that hard. Let me see if there's any other questions. Yeah, that's it. Don't forget to subscribe, like this video, and check out my other socials as well. Okay, bye.